Matt, Nicole, thanks for coming back in. So I've got the reports here from the Allied Health Specialists, and I've just got a few more questions about Daniel. He's 7.
Yeah, that's right, Dr. B.
And you had mentioned before that he has trouble remembering some things that you...
Yes,
Yeah,
I find myself telling him the same thing every day. Pack your bag, have a shower, turn off the lights.
Okay, and how's he getting on with other kids?
Daniel's having a lot of trouble at school. His teacher said he's really sweet, but he struggles to form friendships.
He finds it hard to understand social cues and waiting his turn, things like that.
And how is he at home with the family?
Sometimes I feel like Daniel doesn't even know that he's being naughty. Like, he's my brother and I love him, but not the phone.
Oh, Daniel!
At home he has these meltdowns.
It's getting worse, and we're exhausted.
I think we both try our best, but nothing we do seems to work. I mean, we've tried natural consequences, timeouts, rewards. Parenting Daniel, it's so different to parenting Laura.
And his behaviour, it's really putting a strain on our relationship. We can't even go out as a family. Like, we need help.
Nicole, tell me about your pregnancy with Daniel. Was it planned?
No, actually, falling pregnant with Daniel was a wonderful surprise.
Were there any complications with the birth or pregnancy?
Daniel arrived 2 weeks early, as you know, but that's it. And he was a terrible sleeper.
Okay. Nicole, I'm going to ask you some questions now that might feel a bit personal, but they're only asked to support Daniel's care. Do you remember drinking any alcohol in your pregnancy with Daniel? Or even before you knew you were pregnant?
Well, maybe early on before you realised.
We didn't know Nicole was pregnant for the first couple of months.
Thank you for being so open. Look, many people do drink before they know they're pregnant. So Nicole, think back. Do you have a sense of how often you were drinking?
Just my normal amount, Dr. B, so surely that wouldn't make any difference.
I did drink, but I wasn't a big drinker. Was I?
I think it might be worth exploring a possible fetal alcohol spectrum disorder diagnosis.
But I never drank that much, and I didn't touch it again until after I finished breastfeeding.
Unfortunately, any exposure at all to alcohol during pregnancy can affect the child's development. I know it might not feel like it right now, but you guys are not alone. Avoiding alcohol is important even before you know you're pregnant. With about half of the pregnancies in Australia unplanned, earlier exposure is way more common than people realise. If your child is diagnosed with FASD, there are parent support groups that can be useful. FASD can't be reversed, but early intervention can make life easier and reduce secondary disabilities. Without a correct diagnosis, there's no way of preventing future affected births, and no chance to appropriately support the family.
When patients present with these behaviours, consider FASD in your differential diagnosis and prioritise assessing for a history of parental alcohol exposure.